Good morning, good afternoon, everyone, and welcome to the second day of the Sixth Digital Health Society Summit. On behalf of Bleden Rees, the chair of the Digital Health Society, and myself. My name is Karolina Mackiewicz, and I'm the Innovation Director at the ECH Alliance. The topic of this year's Digital Health Society Summit is modernization in healthcare in the next 5 years. We want to explore how will healthcare embrace digitalization at scale and catch up on other sectors. Over the years, the Digital Health Society and the Digital Health Society Summit established themselves as platforms for bringing together all and the Digital Health Society Summit and the Digital Health Society established themselves as platforms to bring together the stakeholders engaged in the digital and health data. We want to make the knowledge available for all, and that's why the Digital Health Society is free to attend for our participants. Just a couple of words about the topic of this year's summit. As I said, we want to explore how healthcare will catch up on the other sectors, will scale up and make digital the mainstream in the and not that we will in a couple of years we will stop talking about the digital health. The digital health will be simply health. And of course, we see it, for example, in the sector of banking. We rarely talk about the digital banking or e-banking. We simply use our banking app to do the transactions. And perhaps health can learn something from that experience. I will now pass to my colleague, Bleden Rees, to tell you a little bit more about the Digital Health Society and also about our initiatives at the ECH Alliance.
Thanks, Karolina, and hello, everyone. So what is the Digital Health Society? So it is a legacy of the Estonian presidency of the EU in 2017. It involves multi-stakeholders, and as you can see on the screen, the different types of stakeholders, perhaps best illustrated by the fact that today we have 106 registrations from national and regional ministries of health, 173 healthcare professionals and hospitals, 235 universities and researchers, and 165 companies. Looking at the registrations, today they're in fact over 1,300 and some 112 countries. This is the first time that we've had every EU member state represented, as well as the first time having more than 100 countries. So the diversity of attendees is perhaps best illustrated by the job titles of some of the attendees. And as you can see on the screen, it is very diverse. So what does the Digital Health Society do? So essentially, it's about thought leadership. And the summit is itself the best illustration of that. And we get involved in digital and health data activities of the ECH Alliance as the Global Health Connector. And we provide expertise for EU and other international funded projects. And we host an AI club, which I'll say a little bit more in a minute. And we continue to develop our activities. And at the moment, one of the things that we're looking at, which we hope to announce later this year, is hospital clubs for benchmarking, collaborations in innovation, research, and commercial activities. So an example of actually our work is our virtual roundtables, which started 5 years ago and led to calls to action on health data ecosystems, which is really all about the European health data space. So here are the 7 recommendations that we made 5 years ago, which we believe are as relevant today as they were then. And also, we believe they're relevant to any healthcare system around the world. But turning to the output, you can see on the QR code on the slide a link to effectively be able to download and read the 6 reports that you can see on the screen. So we encourage you to do that. Turning a little bit to the AI Club, which is launched a year ago. This has involved members from industry, academics, clinicians, and regulators, all of whom work in health AI. And the idea is to provide a safe space where they can share challenges, discuss possible solutions, and share know-how and information. And we were delighted to see that the club published its first AI report, which again you can download from our QR code that I showed earlier or our website. And in fact, that report's been presented at the UN Science Summit. So in front of you, perhaps, is one of the most important assets of the ECH Alliance, our international ecosystem network. These are communities of all stakeholders needed to transform health and care. They are permanent, and they have to meet at least 4 times a year to do stuff, as we like to say, not talk about doing stuff. And the latest 2 ecosystems are both in the US, in St. Louis and Chicago, demonstrating our expansion of our activities in North America. We also have virtual ecosystem meetings, and these are around the topics that you can see on the slide. So our policy work is probably best illustrated by our activities at the Science Summit of the United Nations in the last 2 years. And as you can see from the slide, this year we had the White House making announcements about funding for women's health research. But then this is a visual portrayal of our flagship events around the world. And all I would like to say here is that we have an increasing range of activities in Africa, and our chairman's just back from Kigali last week, and also in India. So the QR codes I'm going to leave on the slide for a second. These are ways in which you can subscribe to our newsletter if you don't already, or you can become a member of the ECH Alliance Global Health Connector community. So a quick few thank yous. So a thank you to MSD, who are our premium sponsor for the summit, and to our Global Health Connector partners that you can see on the screen, including Health, African Healthcare Business, ATA, and Health Parliament. So with that, thank you. And I think I'm finishing a little early, so in case you have any questions, otherwise we'll move on. But also in the chat, you should also have seen some of the links to our reports that you can follow. So thank you very much.